All right, so this is a question dealing from the last segment. Which of the following statements regarding the heart contraction is true? Pause it, think about it, but I will tell you the answer. The answer is A. The atria contract together before the ventricles. All right, so this one's going to look at our atherosclerosis or heart disease. So we know that the heart or heart attacks is quite a common cause of death in the United States. And the disease that leads to heart attacks is going to be called coronary artery disease, or CAD. So coronary artery disease is the gradual buildup of plaque in the walls of your arteries that supply blood to the heart. And it also happens in arteries that feed the rest of the body as well. But we hear about it most with the heart because the heart is such a vulnerable organ to lack of oxygen. Plaque is made up of deposits of cholesterol and other substances in the artery. Plaque buildup causes the inside of your arteries to narrow over time. That could be partially or totally blocked. So the process of this is called atherosclerosis. Okay. So let's take a look at this plaque and notice one thing here. So this plaque, right, this is going to be cholesterol and fatty acids and lipids that are deposited underneath this lining of your blood vessels. So this is what's interesting, is because it's not just out in the lumen, right? This plaque is actually tucked. It's like putting all your dirt underneath a rug, right? So you'll learn the terminology in the next chapter, chapter 22. This lining of the blood vessel wall is called the endothelium. It is one simple squamous layer of cells, so it's very thin, but for some reason the fats and cholesterol are deposited underneath it. So the blood cells, they don't actually contact the plaque. They're going to just have a smaller lumen to run through as the plaque grows in size. Another thing that happens to these plaques is that they do become hard, so they become calcified and literally very stiff. So you have this very hard lump inside of your blood vessel wall. And so that is also why it's called hardening of the arteries. Hardening of the arteries is called arteriosclerosis. These are atherosclerosis and arteriosclerosis are really just almost interchangeable. There's a slight definition difference between them. So I'm not going to burden you with that, but you'll hear arteriosclerosis and you'll hear atherosclerosis, and you'll also hear hardening of the arteries. And they're referring to basically the same phenomenon as this plaque deposition, the hardening of the plaque. And the danger of hardening that plaque is that your blood vessels have to be elastic. They have to be able to expand under the systolic pressure when your heart's beating, and then they recoil under the relaxation diastolic phase. So they have to be able to be elastic to accommodate the blood pressure. And if you think about this, right, if you have a hard area and the blood vessels expanding or stretching, that hard area doesn't respond in the same way as the rest, and it could actually cause a tear to occur in the blood vessel wall, right? So that's one problem. The other problem is obviously this lumen is getting smaller, and so the amount of blood that's reaching a certain area is going to be limited. So let's take a look at the next picture. So this is a disease that gradually accumulates through decades, right? So we can see that we have an initial lesion, right? So we have sort of normal things. We are slowly depositing some lipids and cholesterol into the wall. Remember, this is all under the rug. So we still have our endothelium here. And we can see the lumen, right? The lumen is getting narrower and narrower and narrower. And this scenario so let's just talk about the narrow lumen. If you look at your complications, letter B, complications from coronary artery disease, let's look at number 2, angina pectoris. The angina condition is where you might have a scenario in here where you have a very narrow lumen in a blood vessel around the heart. So let's say we're talking about the anterior interventricular artery, right? So that really big blood vessel down the front of your heart, if it starts to get blocked, then the ventricles are going to get starved of oxygen and blood flow. Under resting conditions, it might be fine because you're not taxing your heart, you're not asking it to pump harder. So if you're at rest, if you don't have a very active lifestyle, then you might not realize that you have this problem. But let's say a person with a very narrow lumen here starts to either start an exercise regime or maybe just has a day of hard manual labor, and they start to tax their body, right? So the heart needs to pump harder to get the oxygen to their body, but the heart itself is going to start to also need oxygen and blood, but it can't get the adequate amount it needs because your lumen is very narrow from atherosclerosis. So what happens is the heart is going to cry out in pain for oxygen, and it's going to feel like a heart attack because heart attacks are also the heart starts to, feel this loss of oxygen, and it's basically in oxygen deprivation. So we have a situation where the heart is, you feel pain in the chest, it mimics a heart attack, but if you rest, the symptoms can go away, and there's no cardiac muscle death, and that's the key. With angina pectoris, the heart is going to be very in pain, but you're not going to have the cardiac muscle cells die. A heart attack, if you look at number 1, the myocardial infarction, the cardiac muscle dies. So there's a total lack of blood flow to an area of the heart. So let's look at a scenario that can cause a heart attack. So here's something called a complicated lesion. You don't need to know that for the exam, but let's see how the fatty deposits is so large that it's rupturing the smooth endothelium layer here. When you break through that small endothelium layer, not only does the plaque come out, and it could totally block or occlude this small lumen that we have, but your body thinks it's a cut, right? So what does your body do when there is a break in the blood vessel wall? It clots. And so this is going to recruit platelets and clotting factors and fibrin and all that stuff and make a nice big thrombus. Well, what if the clot builds up and it completely occludes the lumen? So now your heart's going to get completely blocked, right? So anything distal from this blockage is not going to get oxygen. And so that can cause myocardial infarction or heart attack. And the portion of the myocardium distally from that blockage is not going to get oxygen. It's also going to die. And if you remember back to your muscle types, cardiac muscle does not regenerate, right? So once you lose a piece of that heart muscle, it does not come back. So that's, again, a very dangerous thing about heart attacks. So this is your sort of view of this coronary artery disease. This is an actual artery, and this white substances, this is the plaque that has been built up over years. This is a histology slide. Look what's left of the lumen. That's it. That's all the lumen that's left where blood can flow through. Everything else here, this is plaque. So you can actually see this fatty substance here, right? This sort of whiter, paler region. That's all plaque. Another sort of complication is stroke, otherwise known as cerebrovascular accident, or CVA. So in your notes, letter D, atherosclerosis is not limited to the vessels around the heart. It's body-wide. You can have atherosclerosis in your femoral artery, in your legs, in your arms. But in your brain, it's also especially scary, right? So you can have two kinds of strokes here. Ischemic strokes are where you have an interruption of blood flow. So this is a scenario where maybe you have a plaque buildup that's very, very large, narrowing the lumen so much so that you block the blood flow to the area of the heart, of the brain, sorry, not the heart, the brain, and that brain dies. Hemorrhagic stroke is where the blood vessel breaks open. So you actually have a bleed inside of your skull, right, in the brain, and that can also be very devastating. So both of those, right, it's because of this kind of atherosclerosis causing the blood vessels to either, shrink their lumen. You could have clots being formed if that plaque breaks through. That's this scenario. Completely blocks the blood flow and you have a stroke. Or the blood vessel breaks open because, remember, the hard artery walls they're inflexible and they're prone to breaking open, all right, because they're inflexible. So lots of scary things. So what risk factors make you vulnerable for atherosclerosis? And you guys could probably guess all of these. I did list some of these under letter A, some kind of factors that can lead to it. But one of the things that you probably already guessed was the cholesterol levels. You want to keep your cholesterol levels low, so you want to get your cholesterol checked. For some people, there's a genetic predisposition to have either medium elevated cholesterol levels or very, very high elevated cholesterol levels. And if you are genetically predispositioned for that, you probably want to take cholesterol lowering drugs at some point. High blood pressure also is a risk factor in atherosclerosis. Smoking is a big risk factor. Insulin resistance and diabetes kind of go together. That's a risk factor. Being overweight or obese, lack of physical activity, having an unhealthy diet. What does that mean? Foods that are high in saturated and trans fats. So saturated fats are animal fats generally. So you're talking about lard on meat, and you're talking about margarine and things like that. Trans fats are fats that you find in packaged foods largely, right? Because trans fats are sort of created for foods to have a longer shelf life. Trans fats don't break down. So crackers that you get at the store, something like Twinkies, all those sort of like baked, I don't know, Twinkies, something like that, where you have a food that has a long shelf life that has fat in it, is probably going to have trans fats. Foods high in cholesterol, high in salt, and high in sugar. Those are all bad. Everything that's probably delicious is bad for you. Older age, we can't help that, but that does put you at risk for atherosclerosis because, again, it's a lifelong buildup, right? So you have years and years of building up these plaques and then a family history. So you can take steps to help yourself, right? If you have a genetic propensity for high blood pressure, then you want to make sure you're not a smoker, and you want to make sure that you have a healthy weight, and you want to make sure you're getting physical activity and eating a healthy diet, right? So do the things that you can control in your life to limit yourself to atherosclerosis, because it is a really huge killer in the westernized society. So what can we do about this, right? So what are some procedures to treat coronary artery disease? Now we're back to the heart. So I want you to know these two procedures. The first one is angioplasty, and I didn't write notes in the outline for this because I usually just talk about this in class. So please just make sure you are listening. Angioplasty is an in and out procedure. So it's not something that you have to go in and stay overnight for. What they do is they will take a catheter and they route this catheter in your body to the blood vessel that has the plaque. And then what they do is they will blow up a balloon. So it's called balloon angioplasty, because literally there is some kind of material that you can inflate, and it just squishes the plaque off to the side, right? So you're basically physically creating a larger lumen with this balloon. And then they put in place a stent. So a stent is this guy right here. It's a mesh tube, and it holds the blood vessel open. All right. Then the plaque is compressed. The stent has been expanded. It doesn't de-expand. The stent just stays in your heart. And then the catheter is withdrawn. And that's the procedure. So you can literally just physically open up a blood vessel. So this is one. The second treatment is bypass surgery. So this is way more invasive. This is basically the last. So this is angioplasty is probably like the first go-to procedure if you have dangerous cardiovascular disease, and then bypass surgery is the last resort. So take a look at what's happening here. So bypass literally means that you're bypassing the blockage. So here's a blockage here. All right. So you should be able to name this blood vessel eventually. This is your right coronary artery. So there's a blockage in the right coronary artery. So think about how dangerous that is, because if you have a blockage right off the bat here, then all of the blood that's trying to go to the back of the heart and also to the right ventricle here, that's not going to reach those areas. So this is a very dangerous blockage. Look at the blockage here. You should also be able to name this one eventually. This is the anterior interventricular artery. It's running down the front of the heart. So if you have a blockage here, all of the sort of anterior surface of the heart, the right and left ventricles, and the posterior side is not going to get blood. These are very dangerous blockages. So what the physician will do is they'll actually take arteries and veins from elsewhere in your body, right? So this is bypass using the saphenous vein. This is using the internal mammary artery. You guys will learn the saphenous vein, but you're not going to learn this one. Anyways, they're going to take vessels from the elsewhere in your body, and they're going to just create a bypass. They're going to create an alternate route for blood. So blood is going to come up the ascending aorta. Instead of traveling down this one, it'll just travel down this one and then come in here, right? And then feed the heart tissue. Same thing here, right? So the blood's going to move up into this structure and then come down and then supply the anterior and posterior sides of the heart. So bypass surgery. I have a video, and then I highly recommend that you watch this heart surgery. I do show it in class, and if you're squeamish and you don't like blood, then I do not recommend that you watch this. But if you are fascinated with surgery films, and this is a really good one because the surgeon does walk you through it, and it's very informative. So I only show parts 1 and 2 in class, but there are more parts to it. So I will link those into the module so you guys can take a look at that. But I highly recommend this heart. Surgery, I won't ask questions from it on the exam. It's just for your own sort of knowledge. All right.